Now here's our first class. We have 47 students who joined us in early July, on the 5th of July for a 2-week residential that launched the 18-month degree program. Among them, 85% already have advanced degrees, 24 are docs, 8 have MBAs, several advanced practice nurses, a couple attorneys. Average work experience of our entering class, 23 years. So these guys have P&L experience. They're in positions where they can actually do something about the things they're learning, which is really exciting. Duke has an MPH, Master's of Public Health, with a heavy MBA content. But the way they put it together is the MPH faculty teach that, and then they bring in the business guys to teach their thing, and the class moves on. We spent a lot of time here, actually a year before we launched, every other week, getting the teaching faculty from TDI and Tuck together, teaching one another the different research bases, the different lenses you use to think about delivery. And there are 2 courses that span the entire curriculum. A leadership course where students told us when they signed up. That's really important to them because nobody taught them that type of thinking. Their board members told us, the institutions that are sponsoring people, if you can train the next generation of leadership for us, we're all over this program because healthcare doesn't do a good job of thinking that way. And then the Action Learning Project, which is designed, it's an 18-month project put together in teams where we take the teaching and cement that in terms of learning. The literature tells us that experiential learning is what really cements learning for adult learners. In Hyderabad, India, at the Aravind Eye Clinic, and we have a student from the Aravind Eye Clinic, a doc who's in our program, all right? So think about asynchronous learning and how that helps him. In Hyderabad, India, they do cataract surgery for $30 a pop. Here we do it for $3,000. So how can we do reverse innovation to bring that back here and do cataract surgery at a price we as a society can afford? Very exciting. And then this is the asynchronous part. This is the professor poses some questions. The students respond to those questions and then respond to other students. So the reading and the lectures are due. The students are supposed to do those early in the week. They respond to the questions and create some discussion by Thursday, and the curriculum specialists and the faculty are wading in and interacting with the discussion. Then for Sunday, so that's due on Thursday. For Sunday, there's generally a group exercise, a case, or some sort of project that the group does. So they can get together, they can use any form of communication they want. The faculty member has Monday to review that with the curriculum specialist, and on Tuesday is the synchronous session. So there we come together in a classroom, which you're going to see in just a minute, and we think about what we learned, we tee up what we're going to talk about for the following week.
So welcome everybody. You've probably been on video conferencing, you probably use it regularly yourselves. This is an Adobe Connect session. It's the technology that we've chosen. It seems to work very well, and it's set up very well for educational purposes. There's no way that experience in the GM classroom or in a small seminar room, you know, what Dartmouth and Tuck and the medical school do so well, there's no way that's going to disappear entirely. However, there are times when this technology is more conducive to the way that people learn best and the way they should be learning. But I'm going to focus in on this case. And what I'd like you to imagine is that we're actually in the Tuesday online live session at the beginning of a week. So we're gonna do this a little bit in the imaginary and abbreviated fashion. The case is on possible acquisition of the Da Vinci surgical robot by a tertiary care hospital in New England. I would think of it as being embedded in the broader topic, however, of the role of technology in healthcare. You start discussing, you lay out some of the facts. You don't want to spend too much time on it. And of course, we got the disadvantage, you guys haven't read the case. But what do you think about the finances of this Da Vinci surgical robot? Gail, if I can give you a quick cold call, what else besides the physical acquisition costs, the capital costs, what other financial aspects? And this is actually an important thing. We're at a business school here, so the first thing I'm jumping into is the financial part of this. And for doctors in the program, That might be a surprise, but we think it's real good for them as well. It's good for everybody. We focus a
Right,
lot.
so I mean,
Go ahead.
first thing I think about is they're gonna have to generate so much utilization of this. So what are the protocols under which they use it? And they're gonna have to justify the revenue model to justify the expense for the purchase at the hospital, so it could drive excess utilization if you're not careful.
So you're jumping into the implications right away of the finances. I've just put up the basic numbers, which would have been in the case. This thing costs $1.5 million upfront purchase price. Not only does it have a huge purchase price, but it's got a service contract going along with it of $120,000. And it's actually got higher cost of consumables as well. If you look at that picture, you can imagine that there's a lot of things that are going to have to be cleaned and or replaced after. Again, I'm not focusing on the case here. What I really want to focus on is how we'd use this case and how we can use it differently in an online program. So what I'm asking here is, and some of you are MBAs, so in a typical MBA classroom, you'd spend an hour and a half on this case. And what would normally happen in that hour and a half? And particularly, where would it be left? Let's see, who else is? Sherry, you were class of '86, right? My second class. So, I mean, can you summarize what happened? How does the professor lead a discussion on something like this? In particular, how does it get left with the students?
So typically the professor would make a couple of opening remarks and to sort of warm everybody up. And my recollection was there were a certain number of students that were the front row types that would jump in with some remarks that would show how well
they'd be waving their hand.
And then there would be the back row group who the professor would cold call on in the event that they weren't piping up.
And then the professor in the end typically wraps it up with his or her viewpoint. And the students go on to the next class. And look, I've been doing this for a long time, and again, I don't want to denigrate it because it's got its use, but in a lot of instances, you leave a little bit unsatisfied, both the students and the professors. So what I'm trying to get you to see here is that this technology both allows us and kind of forces us to break out of our usual teaching method. This is the way I'm going to set up my week. I'm going to start with this Tuesday synchronous session, and I'm trying to get the benefits of us being together from that. And that's one of the things we're really trying to figure out. What's the true benefit of having us all together like this versus being off asynchronously? Midweek is going to be the asynchronous work, which is investigate, discuss, debate, online, a lot of it. And they can actually, in their study groups, they can go into one of these Adobe Connect sessions. We have them set up. So they can have an Adobe Connect session like this just with them. I'd probably have some kind of a hand-in assignment on Thursday. On Sunday night, which is our second night for assignments in this program, I would probably have them do a case write-up and a PowerPoint presentation in their study groups of whatever the questions I would have here. So I want to use this technology in a way that makes the classroom experience that is so special about this place, I want to make that better. So I want to unload the stuff that doesn't need to be done in the classroom. I want the students to do that outside, and then I want them to come into the classroom at a higher level so we can have a better discussion.
One immediate idea people are having is using this Adobe Connect to connect some of our 40 off-campus programs directly into the classroom at a different time zone to have a real conversation on and off campus. You could imagine supplementing that with an asynchronous set of lectures that would be very important on campus, bringing on-campus connected time to do something else. So I think we see this as a great way to learn from this course, but other applications if we could figure out how to do it within an efficient, cost-effective way.